HIPAA orders. In this particular video, we're going to be taking a look at specifically what all is normally included in a HIPAA order and some of the workflows associated with these HIPAA orders. What can we do within the dashboard area, and how can we provide users with an indication, a status, and kind of a workflow kind of funnel that they're going to go through in the ordering process? Okay, let's dive in. So the first thing that we want to point out with HIPAA orders is, depending on your workflow for your business, there may be dependencies on internal kind of approvals. If it's a HIPAA e-commerce store where you're selling drugs or possibly prescription devices that have to have some kind of approval, or a lab test that someone needs, there may be a process where the user actually places the order, but they can't actually receive the item until there's an approval. So that's probably one of the biggest things we want to point out about some of these orders. It's just managing the user's expectations and being able to help them see where they're at in the process. Are they waiting on someone else? How long does that normally take? And if they're not waiting on someone, or it's been approved, etc., how long is the fulfillment going to take from that point on? Normally, there's also a process for once the patient or the end customer receives something, say it's for a lab or in-home care or a device, where they're going to have steps after they purchase that they're going to have to engage in order to get the use of the purchase. And so we encourage you, again, to be thinking about this in this ordering process, to manage their expectations, think about what you want the messaging to be, and constantly work on setting their kind of expectations slightly lower, at least, than what you're definitely able to guarantee you can deliver. Okay, so one of the first things that we'll point out with the ordering side of HIPAA is it can be quite different from traditional e-commerce. Here you can see in this particular dashboard view of the orders, we're showing the particular customer's medications, and we're showing that they have a refill monitor and they have the option to be able to request a refill. They can also go in and see the detailed view of the item. And so this particular medication, they can see all of the detail associated with it, including how many refills they have left, how often, how much they cost. They can see the billing and shipping, as well as the payment information. And then they can also review the order details. And this is going to include comments and information that might be giving them allergies, side effects, kind of patient-specific information, etc. They can also go in and see some of the refill request history, some of the pharmacist information, so they could get in touch with them if they had any questions or issues. And then finally, the doctor information as well. Now, this is going to include the doctor's schedule. And ultimately, what you can see is this is a very rich context for the medication side of things with this order. So we're not just showing a traditional order view, we're showing a lot of information that contextually applies whenever it's relating to medicine. Okay, so next let's take a look at just kind of a generic presentation of a HIPAA order view. And here you can see we have a list of orders. The user can search, they can toggle based on status or filter based on status, ID, key, date range, etc. And they can also sort the columns as well. Then they can go to a detailed view, and you can see that they have the option to print a receipt or start a return. So they can do an RMA, or return merchandise request, basically. And then they also have the ability to go in and view the items that they purchased in their order, as well as add them to their cart. So this might apply for an equipment purchase or something that's kind of a more standard e-commerce type of experience. And you can actually have both this standard e-commerce type of presentation, as well as a more detailed kind of HIPAA specific for medication type of presentation. You can have both of those. You can have these views apply depending on what items are in the order and kind of the composition of that order. And then finally, one of the other things that's interesting is looking at the grouping. So this particular order now is showing invoices tied to the order. So it's possible to break out invoices so that someone can then pay. So they make the order, but then pay with invoices. They may have a payment plan, maybe a subscription, that kind of a thing. And we can show that presented here. And then another view for this actual orders for a HIPAA e-commerce site could be something like this. So you're actually seeing now just kind of a view of someone who's placed different orders. They have different kind of statuses, and then you can see that they have a listing of the items in the order, and they have the ability to reorder items or the ability to reorder all of them. So again, kind of a traditional presentation here, but the main takeaway is that the overall ordering process and the overall kind of order dashboard has a lot of workflows in it depending on your business model. So depending on kind of what jurisdictions, what legal requirements, what kind of workflows are necessary, we can trigger different steps in this process and present those to the users. Whether it's a very simple ordering process where it's just you order it and it's going to be fulfilled, or if it's a very detailed process and there's actually a refill kind of process that needs to occur. Maybe there are steps and notifications for the different parties that are involved. It could be things like a doctor, a pharmacist, and the patient, or possibly a lab technician or a lab result that needs to come back. And ultimately, it could be a device that has to integrate and show data. Then that data has to go to a telehealth specialist. And then that would then allow the telehealth specialist to approve everything. Maybe there has to then be an e-signature from your doctor. And then finally, you can proceed with the process. Whatever it is, we're able to present that in a very reasonable way and do it in a way that is intuitive to the user. So ultimately, with the HIPAA ordering process and the orders view, there's a lot of customization that we can apply, and we can simplify it to match your specific workflow and your specific business. We certainly hope that was helpful. If you are looking at adjusting or customizing your HIPAA order process and your HIPAA order dashboard, we recommend a complimentary review and that you talk with an expert who has done this before in your field. And we're going to talk about that here briefly and what the options are that you may want to consider as you approach your HIPAA orders and your overall HIPAA project coming up. Okay, so we hope that you've enjoyed the video that we just covered. And ultimately, one of the big takeaways that we want to encourage you to consider is that we do offer a complimentary discovery process and a lot of additional resources that are complementary related to this topic. One of the biggest things about the Clarity software and the overall Clarity process is we really like to build long-term relationships. In fact, we really see this as an opportunity to help, even if there isn't a good fit for us to directly work together. We really care about this industry and what's going on in the space, and we encourage you to take advantage of our complementary resources as well as our complementary discovery and strategy sessions that we can offer. If we can help, we certainly encourage you to dig in with us and ask for support as you approach any of your upcoming projects. And with that said, if you would help us as well to get the word out about this valuable service and these valuable resources, we just ask that you hit the like button and subscribe if you're watching this online, and we will look forward to seeing you in the next video. Thanks for watching, and bye for now.